Greetings. My name is Ryan Smith. I'm the director of the City of Durham's Community Safety Department. We've put together a brief video for you today so that you can better understand what to expect as we begin to roll out new pilot crisis response approaches in Durham. The week of June 27th, we will launch 3 new pilot crisis response approaches in the City of Durham. We'll be embedding mental health clinicians into our 911 call center in a program we're calling Crisis Call Diversion. We'll be dispatching through 911 3-person teams who are unarmed responders to nonviolent behavioral health calls and calls involving quality of life concerns. And we'll be providing dedicated follow-up. Within 48 hours after initial encounter, a peer support specialist and clinician will follow up with someone to help connect them to the care that they want and need. These pilots are intended to help us in Durham do an even better job of meeting people where they're at and meeting the needs of residents who are experiencing behavioral health crises or other quality of life concerns by connecting them to the care that they need and want by sending responses that best match their needs. Later this summer, we're also going to launch a 4th pilot in partnership with Durham Police Department, a co-response pilot that pairs clinicians with CIT trained officers. That pilot is intended to help us make sure that regardless of the risk involved in a call, if a call involves a behavioral health related need, that we're able to support law enforcement in meeting the needs of residents by sending mental health professionals. We want our public safety partners to know that these pilots have been carefully planned over the last year. They've been planned in ways that are community informed, that are data driven, that are evidence based, but also in ways that are highly collaborative. And I really want to drive that point home. We have not developed these pilots in isolation. We have met consistently and repeatedly with representatives from police, fire, EMS, emergency communications, other behavioral health providers as part of a multi-agency planning process that we led. All of that feedback has gone in to make these pilots even better, and we're appreciative of the ongoing collaboration and strong partnerships we have with our other public safety agencies. We will be the first in North Carolina. This is an exciting time, a first to have clinicians in our 911 call center, the first to be dispatching unarmed response teams. And that's exciting, but I also want you to know that while we're the first in our state, we're not the first in our country. And we have taken full advantage of the opportunity to learn from other cities in this country who are doing this work, doing it well, and showing that it can help us better meet the needs of residents in crisis and do so in a way that is consistent with the safety of everyone on scene, including our responders.
Let me talk briefly about the look of our new department. We want to make sure that our other first responders out in the field can recognize us. All of our responders will be operating under a new brand. We will be Heart Responders. You can see the logo here. You'll see this on all of our shirts and on our vehicles when we're out in the community. Heart means holistic, empathetic assistance response teams.
In this video, you're going to get to hear from other members of the Community Safety Department. And our goal is to help set expectations so you know what to expect, and our pilots, you know what to expect if you meet one of our responders out in the field. Thank you.
Hi, my name is Lee Mazer, and I am one of the clinical managers within the Community Safety Department. I'm going to be overseeing the Crisis Call Diversion pilot. And our goal with this pilot is to actually have clinicians embedded within the 911 call center. These clinicians will triage, assess, and respond to calls for service, specifically with calls that have a focus on behavioral health crises or involve someone endorsing threats of suicide. The goal of adding clinicians is to quickly connect people who are experiencing a mental health crisis or have a loved one who are experiencing a crisis with a mental health professional. Clinicians will serve 2 primary roles within the 911 call center. First, they're going to enable us to respond to some behavioral health calls and calls for service remotely. Some people call and may just need a referral to services. Others may just need someone to talk to. Mental health clinicians are going to help us better support people in these moments and divert unnecessary in-person responses. Secondly, when we need to dispatch in-person responders, clinicians in 911 can also provide crucial information. They could help de-escalate situations before responders arrive on scene and provide these responders with helpful information about the person in crisis. Durham will be the first city in North Carolina to put mental health clinicians in the 911 call center. But other cities, like Austin, are leading the way and showing us the benefits. Austin now has 18 clinicians in their 911 call center. They've recently shared an example of the difference it can make. Someone called 911 threatening suicide with a weapon in their possession. Austin dispatched, just like we would, police and EMS to the home. But the clinician remained on the phone with the person and was able to de-escalate the situation and get the person to put their weapon away before the responders arrived on scene, which made everyone who arrived on scene safer. Having mental health clinicians in 911 just makes sense.
Peace. My name is Abena, and I'm one of the clinical managers here with the Durham Community Safety Department. Prior to my role with this department, I served as the CIT clinician with the Durham Police Department for over 3 years. I bring the expertise that I gained in that position to this role. I will be managing our unarmed community response teams comprised of 3 staff members, a licensed clinician, a peer support specialist, and an EMT. Our staff come with expertise in crisis response. We have further enhanced those skills by providing trainings such as de-escalation, ACEs training, motivational interviewing, mental health first aid, CIT, and many, many more. Our staff will respond to low-level, non-violent 911 calls. Those calls will come directly through dispatch as well as being self-initiated by our responders. We will also be receiving referrals from our partner responders. We will be providing rapid and trauma-informed care to our neighbors. We will be person-centered and community-based in our responses. We will have snacks and water, supplies, and resources that we will be able to distribute, building that relationship. We will also be able to transport folks to different services, such as the Durham Recovery Response Center, the behavioral health units, just providing that care and that resource to them.
One of the many things we've heard from residents, community partners, and other cities doing this work is the importance of dedicated follow-up care after the initial response. The goal of our care navigation pilot is to reconnect with our neighbors within 48 hours of the first encounter with one of our teams. Across the country, this kind of follow-up care is proving itself to be an essential piece to connecting residents with the care and resources they need. This may be over the phone or in person, in which case one of our clinicians and peer support specialists will follow up together. We are also creating a simple referral form that other first responders can use when they encounter a community member in need of follow-up services with one of our staff.
The public safety response system begins with 911. 911 call takers perform a critical role in categorizing, triaging, and prioritizing incoming calls. Dispatchers then route those calls for service to the appropriate response. The Durham Community Safety Department is a new 4th first responder in the public safety system, alongside police, fire, and EMS. As we incorporated DCSD's new response models into the existing public safety system here in Durham, several goals were achieved.
First, we worked creatively within the existing 911 call-taking protocols. This minimized the overall impact to our call takers and dispatchers. It enabled us to quickly integrate a very detailed and thorough response plan. Second, we automated as much as possible. This provides a highly efficient workflow for 911. It also lays a firm foundation for excellent data fidelity, which will be vital to performance metrics and measuring success. 34 new nature codes have been created in CAD for DCSD responses. Third, We prioritize the safety of our responders. To accomplish this, we leverage the triage questions of the Emergency Police Dispatch, or EPD protocol, that produce almost 1,400 unique final determinant codes. This flexibility enabled us to identify very specific responses with the goal of sending the appropriate response for each call. Our responders will also have public safety radios, tablets connected to CAD, and AVL. And finally, we upheld the importance of clear communication through policies and training. Several policies were written or updated for 911 communications. These policies were thoroughly vetted through their administration and policy oversight committee. DCSD and DECC collaborated on training for all 911 operations staff. Also, this video is part of our plan to transparently communicate what we're doing to our public safety partners.
The overall goal is to evaluate these responses in action, while our future goal is to be available throughout the entire city of Durham 24 hours a day, 7 days a week. We do not have the resources right now to accomplish this during the pilot period.
Initially, community response teams, care navigators, and co-response teams will be operating in a limited geographic area comprised of the following 8 police beats: 112, 113, 214, 223, 411, 511, 512, and 513. This area was carefully chosen according to the following parameters: utilization of existing boundaries that enable efficient analysis and configuration of CAD for unit recommendation, thorough analysis of historical calls for service data to identify the areas with the highest concentration of need for our services, a geographically contiguous area in which we can focus our efforts, minimizing response time and maximizing the number of calls we can respond to, and collaboration with city management. Initial hours of operation for our programs will be Monday through Friday, 0800 to 1700. Our goal is to expand to coverage 7 days a week by early fall 2022, followed by extending our coverage hours to 0800 to 2300. Throughout the pilot period, we will carefully evaluate data and thoroughly planned metrics.
DCSD is committed to using data as a core part of our learning process. We use data for 3 primary reasons. 1 is to track progress towards goals. 2 is to identify areas that we can learn more about. 3 is to plan how we can go about learning. We're broadly interested in 4 thematic areas. The first is our calls. How many calls did we receive? When did we receive them? How fast do we get to them? The second is our outcomes. How were our calls resolved? How many referrals did we make? How many times did our units have to call for police backup, fire backup, or EMS backup? The third area are our neighbors themselves. We want to understand what barriers to service they're experiencing, what supports they have, and from what backgrounds they originate. The fourth area is about our responders. We want to make sure that our responders are feeling healthy, happy, and whole. This means thinking about, well, did our responders experience any secondary traumatic stress? Are they experiencing compassion fatigue? And do they feel safe on scene? We're going to be collecting all this data and making a portion of it available to the public using a set of dashboards that will be on our website. Those dashboards are going to be updated weekly. We draw our data from 2 primary sources. The first is CAD, which most public safety departments use. The second is Gelada, which is a clinical management software that we're currently in the process of configuring. One important thing about Gelada: that gives us the ability to create a very simple referral form for our services, which means that as you're out in the field, if you close an incident and think to yourself, hey, this person could use some extra follow-up support, they could use some behavioral health support, they might need some care navigation assistance, you can quickly fill out that form and send it, and it bounces right over to us.
We're really excited to begin this work, and as we do so, I want to make sure to take a note of thanks and appreciation to Chief Zoldas, to Chief Andrews, to Director Beeman, to Chief Lockhart, We are really appreciative of the strong collaborative way in which we've been able to develop these pilots. You know, we go into this work with a lot of humility. Yes, we have planned hard, but this is difficult work, and we know that we're going to learn important things. But it's this spirit of collaboration that has been throughout our first year in planning, the strong collaboration that we have with our other public safety partners that gives me and our department added confidence as we head into this new pilot period that yes, we will learn, but we'll get better at this, and we'll get better at it because of the strong support that we have from partners like you. So thanks again. We're very proud to be part of the Durham Public Safety team and look forward to the work ahead.